Emergency medicine block for the 7th semester in medical faculty. The emergency medicine block is an essential part of the medical curriculum. Designed to equip students with the knowledge and skills to manage critical medical conditions requiring immediate intervention. In this block, students learn rapid assessment, patient stabilization, and management of various medical, surgical, and trauma emergencies. Below is a detailed explanation of the block. 1. Introduction. Principles of emergency medicine. A definition of emergency. A condition that threatens life or organ function, requiring immediate intervention to prevent death or permanent disability. B. Objectives of emergency management. Identify life-threatening conditions. Stabilize the patient's condition. Ensure safe referral or further treatment. C. Systematic approach in emergency situations. ABCDE. Airway, breathing. Circulation, disability, exposure, a fundamental guide for assessing and stabilizing patients. Primary survey, rapid assessment to identify life-threatening issues. Secondary survey, comprehensive evaluation to identify additional problems. 2. Airway management, identifying airway problems, airway obstruction, e.g., foreign objects, facial trauma. Airway edema, e.g., severe allergic reaction. B. Interventions, positioning the patient to open the airway. Techniques such as the head tilt chin lift or jaw thrust maneuver. Using airway adjuncts like oropharyngeal airway, OPA, or nasopharyngeal airway, NPA. Endotracheal intubation for severe respiratory failure. 3. Breathing management. A. Identifying breathing problems. Acute respiratory failure, e.g., severe asthma, pneumonia, pneumothorax. Ventilation issues, e.g., chest trauma. B. Interventions. Providing supplemental oxygen via nasal cannula, oxygen mask, or mechanical ventilation. Managing pneumothorax with needle thoracostomy or chest tube insertion. 4. Circulation management. A. Identifying circulation problems. Shock, hypovolemic, cardiogenic, septic, anaphylactic. Sudden cardiac arrest. B. Interventions, assessing vital signs, blood pressure, pulse, peripheral perfusion. Fluid resuscitation with crystalloids, Ringer's lactate or 0.9% sodium chloride. Administering vasopressors, e.g., norepinephrine, for refractory shock. Performing cardiopulmonary resuscitation, CPR, in cardiac arrest. 5. Disability, neurological management. Identifying neurological problems, decreased consciousness, Glasgow Coma Scale, GCS. Seizures. B. Interventions, ensuring optimal brain oxygenation and perfusion. Administering anti-seizure medications like diazepam or phenytoin. Managing head injuries with cervical spine stabilization. 6. Exposure management, complete examination, identifying issues, burns, hidden bleeding, or other signs of trauma. B. Interventions. Conducting a head-to-toe physical examination. Preventing hypothermia by maintaining the patient's body temperature. 7. Specific emergency conditions. A trauma. 1. Head trauma. Managing traumatic brain injuries, TBI. Intervention. Intracranial pressure management. 2. Thoracic trauma. Managing hemothorax or pneumothorax. 3. Abdominal trauma. Detecting internal bleeding using fast, focused assessment with sonography for trauma. 4. Musculoskeletal trauma. Managing fractures with immobilization. B. Cardiac arrest. 1. Recognizing heart rhythms, shockable rhythms, ventricular fibrillation, pulseless ventricular tachycardia. Non-shockable rhythms, asystole, pulseless electrical activity, P. 2. Procedures. Performing CPR, 30:2 ratio. Using an automated external defibrillator, AED, if available. Administering adrenaline or amiodarone according to ACLS protocols. C. Shock. 1. Hypovolemic shock, causes. Massive bleeding, severe dehydration. Intervention. Blood transfusion or intravenous fluids. 2. Anaphylactic shock, causes, severe allergic reaction. Intervention, intramuscular adrenaline. Intravenous fluids, antihistamines. 3. Cardiogenic shock, causes, acute myocardial infarction. Intervention, inotropic support such as dobutamine. 8. Practical training in the emergency medicine block, a medical simulations. 1. CPR, cardiopulmonary resuscitation, practicing CPR on mannequins. Using a defibrillator. 2. Intubation. Training on endotracheal tube placement. 3. Trauma management. Spinal immobilization. Wound suturing. B. Emergency procedure training. Establishing intravenous, IV, access. Performing pleural puncture for pneumothorax. Conducting lumbar punctures for acute neurological conditions. 9. Ethics and communication in emergency medicine. A. Communication with the patient's family, providing clear and quick information about the patient's condition. Discussing difficult decisions such as resuscitation or end-of-life care. B. Teamwork. Emphasizing collaboration with other healthcare professionals, such as nurses and specialists. 10. Patient evaluation and monitoring. A continuous monitoring, vital signs, blood pressure, heart rate. Oxygen saturation. Further evaluations with imaging or laboratory tests. B. Referrals. Determining when the patient needs referral to a more advanced facility. The emergency medicine block aims to train students to become doctors capable of responding quickly and accurately in critical situations, ensuring effective emergency care.